Is the CELLBOOSTER shape. And actually for all of you, this is the premiere here in the Saudi Arabia. So let me tell you a little bit more about the product. The product here is a medical device. It is produced in Switzerland, in Europe. It's a high quality, and the main advantage of the product is actually that the hyaluronic acid here is non-cross-linked but stabilized. So it's actually going to be inside of the body for a longer period of time. Test and count 1, 2, 3, 4, 5 and more. You can see actually that there's still a little bit of the skin, going there, and she actually needs to improve the quality of the skin. So this product is very, very good for that as well. And then if you see, there is also the slight excess of the skin here, so we're going to treat it as well. I'm going to create a couple of lines. The first line is actually mid-pupillary line. The lateral one is actually the line that is going from the lateral canthus to down, and then there is of course the medial canthus line. At the points where we actually have those two lines crossing each other, what we're going to do on these lines, we're going to make a perpendicular injection all the way to the bone and inject like a little quantities of the CELLBOOSTER shape, because that is going to help improve the lymphatic drainage in this area. So this is going to be really, really deep in the layer of the periosteum and the deep, deep fat. But on the layer of the superficial fat, which is the area actually of the malar fat pad, which is here, what we actually have to do is going a little bit more superficial. Still using a needle, but for this we can use a cannula as well. What I'm going to do, I'm going to make a couple of injection points here and then move the transformation of the fatty acids through the Krebs cycle and transforming into the adenosine triphosphate that we're actually using it for the energy. And at the end, on the most superficial layer, what we're going to do is actually we're going to do a microdermal puffiness, because this product, because it contains a high concentration of the non-cross-linked hyaluronic acid, is actually going to increase the hydration and the skin quality. So in the area here, all around the face, okay, or in this case, just around the eyes, what I'm going to do, I'm going to make a little microdermal papulas in the superficial dermal layer. We're going to inject the product to improve the lymphatic drainage. And then in a superficial fatty layer, we're going to decrease the amount, the fatty tissue, and then on the most superficial layer, the skin, we're going to increase the quality of the skin. So, the patient was already cleansed, was already completely disinfected, but as you saw, I was drawing. Actually, I'm just going to do like pressing and touching without swiping. The swiping will remove the product. So what I need the product. Okay, do you need that? Yes. So this is the product that we are using. Okay. So what I like to use are those 1 ml syringes and very, very tiny needles. These are the 34 gauge needles. So they're very, very thin and very easy. The main idea here is actually for you as a doctor to have a very fast treatment with the patient. Of course, in my office, I would already treated her, but this is a live demo, so I need to entertain you and inform you and then to show you. So I'm going to speak as well. So this is the cell booster shape, the 34 gauge needle. What I'm going to do on these three, I'm going to inject like 0.1 and not more, because you have also to be careful, because this product contains a lot of hyaluronic acid. So in the area around here, if you overdo it, you can have also the edema from the hyaluronic acid. But we want to remove that. Okay? So again, 0.1, and the third point, once again, 0.1. So all of this was almost all the way to the bone, because the lymphatic vessels are there. So we need the new syringe. Yeah. Okay, so I just changed the syringe, and actually because of the new needle. And now I'm going to treat the superficial fat. The superficial fat I'm going to treat in the area here. So I'm going to inject it inside. And actually my needle is parallel to the skin, but under the skin. And I'm going to inject very slowly. And of course not a lot of product. Once again, not more than 0.1 per injection, please. Okay. So, doctor, how is this painful when you compare it to other products that you've been treated? No pain. Okay. Actually, that's what I wanted to hear. And actually, this is very, very fruitful. First, of course, there is just a little bit pain because there is the needle, but this needle is very tiny, so it does not cause a lot of damage, of course, but you feel it. But it's okay, because even if you do the anesthetic for some products, it still hurts. But with this one, no anesthetic at all. We didn't bring anything, we didn't apply inside of the product or topical anesthetic. So I need the new needle. Yes. Okay. And then the last step around here that I'm going to do is going to be for the biorevitalization of the skin around the eyes, and for that I'm going to do a microdermal papulas with the cell booster shape. And because this product is actually not containing the sodium deoxycholate, it can be fully, securely, without any problem, injected inside of the skin, because it is going to diminish the wrinkle, it is going to improve the quality of the skin. And for all of you actually that are going to be tomorrow at my lecture, I'm going to show you some clinical study done on the patients, that actually this product is going to improve the quality by actually diminishing the size of the wrinkles, as well as improving skin quality by redensification of the tissue. So you need only one product for this area around the eyes. Of course, if you have a different patient that is only having the skin laxity, in that case I would definitely prefer to do a cell booster lift, not the needle. Yes. And because, as I already told you, I'm not using any anesthetic, because I have a busy back-to-back office in my hometown, and actually I don't have time And unfortunately, the patients, they don't have time as well for waiting too long. They want just to get in, get out, and have the treatment done. So for very, very long time, I'm actually not using anesthetic. Well, at least when I'm doing it just with cannula, I'm injecting it at the part where I'm just going to inject the cannula, but not somewhere else. So, also, what we can do to her as well, I need a disinfectant, okay? Yes. So, because we still have some product left, okay? And here we have gels, and to improve the quality of those gels, what I'm going to do actually, I'm going to create like a little network, and in that network I'm going to inject the product like 3 to 4 millimeters depth, and this is going to, as I told you, decrease the quantity of the fatty cells and improve the quality of the skin, which is really amazing because